My name is Jason Smith. I'm a physician assistant here at Idaho Dermatology. I'm originally from the Phoenix, Arizona area, but I've lived here in Idaho now for a year. I did my undergraduate at the University of Nevada, Las Vegas before I went to PA school at Duke University out in North Carolina. I've been a practicing PA for 5 years now. I worked in family medicine for just over 2 years, right out of PA school. And then after working in family medicine, I did orthopedic surgery for 2 years, where I was working in the OR, doing surgeries and sewing and all sorts of fun stuff. Been with Ada West for about a year now, and I've loved every minute of it. What I love about Ada West is the family atmosphere we have here. We truly love one another, we take care of one another, we look out for one another, and everyone is truly committed to the best patient care possible. So I know that regardless of who I'm working with, they are going to treat my patients with the utmost respect and care, which means y'all get the best care possible. So what brought me into dermatology is I practiced family medicine for a couple of years before going into surgery, and there were aspects of family medicine and surgery that I loved. And dermatology combines all my favorite things of those fields into one field. I also love that with dermatology, you have to use both your brain and your hands. It takes a lot of problem solving. It requires a lot of critical thinking, but it also requires being good with your hands in order to do surgeries and biopsies and all sorts of procedures. So for me, it takes the best of all the different fields of medicine and combines them into one. Right now in dermatology is super exciting. There are so many advances in diseases that used to be pretty crippling for patients. Things like atopic dermatitis or eczema. We now have medications that can essentially clear the eczema. Same with psoriasis. We now have medications that can essentially completely clear your psoriasis. And these are things we didn't have before, where, before people were having to put creams all over their bodies trying to control these terrible diseases. And now we have medications where, an injection or two a month and it will clear the psoriasis. And so it's a really fun and exciting time in dermatology because of all these new developments that we have for treating very complicated diseases. I wish patients understood the effects of the sun. I have tons of patients coming into the clinic telling me, Jason, I have these spots here on my neck. I have these spots developing all across my back. Can you get rid of them? And there are things we can do to help, but a lot of times the best thing to do is just protect yourself from the sun, and that will prevent a whole host of spots from popping up on your body. I also wish patients understood the dangers of tanning beds. I still have patients coming in telling me, Jason, I use tanning beds, but it's just to get a base tan before I go to Hawaii. That's still not okay. Tanning beds are always bad. They significantly increase your risk of skin cancer. So I wish patients understood that risk and stayed away from the tanning beds. So the way I stay current as far as all the new and upcoming treatments and research with dermatology is just lots and lots of reading. I'm constantly reading up on the newest treatments and developments in dermatology, going to conferences 1 to 2 times a year, conversing with my peers. Luckily, there are a lot of resources out there for us to make sure we stay current so that our patients get the best care. So when looking for a dermatologist, I tell patients, look for someone that's willing to take the time to listen to you. What you have to say is important. What you have to say helps us with our diagnoses. So look for someone that's willing to listen to you, and then take time to look at it, explain what's going on so that you know what's going on. Because if you know what's going on and we know what's going on, it's going to ensure that you get the best care possible. So I think everyone could benefit from a trip to the dermatologist. We take care of everything from sunspots to acne to skin cancers to all sorts of rashes. I think everyone can benefit from a dermatologist. However, there are some people that are at a little bit more risk for skin cancers. For example, if you have a family history of skin cancer, or you have a history of tanning bed use, or you have blistering sunburns in your past. If you have any of those 3 things, I think it's a good idea to come in, get a skin check, and just make sure that you're not developing anything that we should take care of. So my best skin advice would be number 1, wear your sunscreen. There's a lot of great sunscreens out there. If you're concerned about chemical sunscreens, there's mineral sunscreens. But as far as sunscreen goes, we always recommend SPF 30 or higher. And then just remember to reapply every 1 to 2 hours, because it does lose its effectiveness after an hour or two. So number one, wear the sunscreen. And then number two, moisturize your skin. Right after you get out of the shower, out of a bath, pat dry real quick so there's still a little moisture on the skin, and then put on a nice moisturizer. Make sure that you use body moisturizer for the body and facial moisturizer for the face, because we don't want to be putting things on our face that's meant for our body. The reason for that being that if you put a body moisturizer on your face, it can actually cause acne, it can plug your pores. So we want to make sure that things meant for the face are on the face and things meant for the body are on the body. But one thing I learned on the job that they never taught me in school is just, for us as providers, be ourselves. Patients appreciate, I think y'all appreciate honesty and us being real with you. So that's one thing I learned on the job. I love Idaho. I love the 4 seasons. I love the mountains. I love the hiking and all of the access to outdoor activities. My family and I love being out in nature, and we love being in this state. It's just full of so many good people and so many fun things to do. One thing we love doing as a family is just walking down the Boise River. My kids love being on those paths, throwing rocks in the river, riding their bikes down it. So we love having that right here in the city. And we also love that we can escape out to all sorts of adventures just a couple hours away. I love basketball. Any of y'all that have come to see me already, you've probably seen my basketball room. I love the Phoenix Suns. I was born and raised in Phoenix, Arizona, so I'm a diehard Phoenix Suns fan. I also went to Duke, so I was fully indoctrinated and brainwashed into loving Duke basketball. So I love Duke basketball, follow Duke basketball, and I just love sports in general. I played tons of sports growing up. The best health practice I do for myself is I try to work out at least 3 to 4 times a week. It keeps me happy, it keeps me sane, and just keeps me feeling good. So I try to get out and be active, whether that's a run or in the gym or just out on a nice walk with my family. Try to get out and get some fresh air every week. Probably the craziest thing I've seen so far in dermatology are when patients are worried about coming in to see us and they allow spots to grow. We've seen massive skin cancers on people's head or other parts of their bodies, where if the patient would have come in when that spot appeared, a new spot that was dark or scaly, and if they would have come in earlier, we could have easily taken care of that skin cancer. But instead, they were nervous about it, understandably, and waited, and then it becomes these gigantic cancers that are really difficult to treat. So if you're watching this and you see something new, it's growing, it's scaly, it's not healing, please don't feel like it's a nuisance to come in and talk to us. We want to see those things. We want to take care of those things. And you may come in and we tell you it's totally fine, it's totally harmless, and that's good. We love giving people reassurance on those things, but we also love catching things when they're small. So please, if you notice anything, come see us, and we'll either reassure you or we'll make sure you're taken care of. So when I was 15 years old, I would have told myself, put on your darn shirt and some sunscreen while you're out mowing the lawn. Take better care of your skin. Know that the sun can cause a whole host of problems, and wear your sunscreen. The very first job I had was probably mowing lawns when I was like 10 years old, going neighbor to neighbor. And then after that, when I was 14, I worked in the school cafeteria. What those jobs taught me is, persevere. Yard work's not easy, especially, I grew up in Arizona where it was 115 degrees and I'm outside mowing the lawn. So it taught me to persevere through hard things. Also taught me to treat people well. When I was working in the cafeteria, you want to be pleasant and customers always right type of thing. So treat people with respect and treat them kindly, and everyone's happy. So a couple things that always surprise people about me is I'm not in my 20s, even though I may look young. And then the other thing is I've actually fractured my back twice when I was in high school and had to be in body casts, and not fun. So I've had, fractured my back twice and still am walking and staying active. I would rather die than eat yellow snow or chew gum off of a handrail. My my germophobia doesn't allow me to answer that question. Urine is sterile, so that's probably the better way to go. So for those of you that are athletes, play sports, one great skin care tip that I can give you is there are some wipes. They're called simple wipes. And these are great things to use if you can't get to the shower right after to wash your face off, especially those of you that struggle with acne. These simple wipes, and don't worry, we're not sponsored by them or anything, but these simple wipes are great just to wipe down your face and get the gunk off from getting sweaty and dirty out playing sports, and it can help reduce some of the mechanical acne that comes from sports.